Senolytics are drugs that are used to remove senescent cells from the body. Let me explain briefly. As a person ages, cells become incapacitated, which means that they lose their function, their ability to destroy themselves and remove themselves from the body so that new healthy cells can grow. These cells are called senescent cells. They remain in the human body despite their dysfunction. And they also produce a secretome, which is a common property of cells. This secretome is pro-inflammatory, meaning that it causes inflammatory processes in the human body. The aging process is usually associated with inflammation, a phenomenon called inflammaging. So there are certain drugs that can remove senescent cells from the body. Several years ago, the Mayo Clinic published an important scientific paper describing these findings in animal models of rats. Senolytics were given to old rats that had gray hair and were reluctant to run. Over time, their fur returned to brown or black, they ran better on wheels, and the function of their immune and cardiovascular systems improved. At this point, clinical trials have already been conducted, including at the Mayo Clinic, which have demonstrated and proven that up to 30% of senescent cells can be removed from the human body in just one course of therapy. So we are now offering this treatment option to patients. There are several drugs available to kill senescent cells. In our work, we follow the scientific publications of the Mayo Clinic and use the drugs recommended by this medical institution. They have to be taken within 3 days. The patient will stay at the clinic for 3 days so that we can monitor him or her and perform the appropriate blood tests. Patients are advised to repeat the treatment in 4 to 6 weeks. So the question was as follows: can stem cell therapy be combined with senolytics? Yes, they can be combined. They are two different approaches to anti-aging, but they are not mutually exclusive. They are synergistic and complementary. In general, patients report feeling better and having more energy after the procedure. Some of our patients are men who regularly run the same distances and say they can run longer distances after treatment. Men also report improvements in their erections. These are the results. Of course, this is only a subjective assessment, but since patients report similar changes after therapy, we believe that they reflect treatment effects. Currently, one of our patients is a man in his 80s who regularly undergoes the anti-aging stem cell secretome therapy. Despite his age, he is quite active, so we have not yet seen any noticeable improvements so far. Women also report having more energy. Aging is associated with inflammatory processes that affect the joints. For example, patients including women report relief from joint and back pain. This is certainly related to the control of inflammatory processes.